Well, good evening, everyone. Thank you so much for joining me this evening for our webinar sponsored by the Wrigley Oral Healthcare Programme. I know many of us will have been working in clinic today, so again, thank you for tuning in after a long day at work. And also I'd like to welcome some of our international listeners too. So what we're going to be doing this evening is looking at snacking, and I thought we could have a look at the oral health and systemic implications of snacking. Often when we consider the oral health and systemic implications, this is where we get a crossroads of opinion. As a dental hygienist, I really don't want my patients eating in between meals and exposing their teeth and hard tissues to sugar and all those kind of things. But at the same time, as a nutrition consultant, I see the value of patients being able to snack. And in some people, it is actually a necessity for their overall health. So I thought perhaps this evening what we could do is take a look at some of the worldwide changes in our eating patterns over the last 10 years or so, and also sort of take a look at some of the changes in the types of food that we eat and the way we eat in the 21st century. I also particularly wanted to look at the oral health of the fruit juice and smoothie generation, not just in terms of how it has affected the enamel and the hard tissues in the mouth, but also to consider the systemic implications and really sort of have a look at what really started out as a health food craze, the latest healthiest thing to do, how that we realise now that how that has impacted on the nation's overall health too. So we're going to take a look at that. Finally, I wanted to look at the implications of snacking on both the oral and systemic health, and to really look at different types of snacking behaviour, and more importantly, the type of foods that people do snack on. Finally, how do we marry the two? So again, we're going to take a look at some effective recommendations we can give to our patients that will provide oral health solutions. So what we're doing really is promoting systemic health, but at the same time, we are protecting our patients' oral health too. So we know that over the last century, eating habits in the UK have really dramatically changed. The eating habits of our parents and our grandparents would be completely unrecognisable to many of us today. For many families, eating patterns really varied little from week to week. So they would always be a Sunday roast. This would be followed by a few days of leftover meat recycling, so pies would be made, casseroles and stews. But by the time Friday came, the meat would have run out, and